So for those of you that joined us 2 weeks ago, we had a fantastic turnout. We had some great physician presenters. It was a phenomenal event. It was very well received. So we decided we're going to do it again 2 weeks later, and here we are. We're going to continue to do this every 2 weeks for physicians, and we're going to have physicians on the calls as well, giving us all some of their experience and knowledge with the technology that we offer. And so we're going to go ahead and get started. So what we're going to be talking about tonight is adding practice value using preventative medicine technology. For physicians that are on the call, this is a great opportunity for you to evaluate this technology and how it's going to fit into your practice, and most importantly, hear from some of your peers and how they've integrated this into their practice, helping their patients and driving revenue for their practice. So we're lucky enough tonight to have some physician speakers and then a special guest speaker tonight. So we've got Dr. Andy Feltz, Dr. Lewis Cady, Dr. Scott Sanderson, and then our special guest is Tanner Gibb, who is the manager of technical communications for PHARMANEX. He's a great resource for everything related to the scanner and the nutritional therapies that we provide. And then there's 4 presenters, Lawrence Kazan-Cassini. He was a Fortune 500 executive. He's very interested in preventive medicine, and he's also worked in corporate wellness. Michael Cook is joining us as well. He's an international entrepreneur, and he's been with PHARMANEX for the last 8 years. Ryan Lucci was in medical device sales for 5.5 years, and he's been with PHARMANEX for 2 years. I'm going to be presenting the initial material here on the opportunity. I had 23 years in medical device sales, helped develop a few products, was involved with a few startups, and also done some corporate training. So the agenda for tonight, we're about 10-minute presentation from myself on the scanner science and technology, the science-based evidence. Then we're going to hear from our physician speakers, and then a Q&A session, and then how we can integrate this into your practice. And then if we have time, we're going to get into the revenue projections for those who want to hear about that. So we're looking to go about an hour this evening. We may run over, so for those of you who need to get off after an hour, feel free to do so. But if you'd like to, as long as it's valuable for you, the information that we're discussing, please stay on. If you have any questions, go ahead and start typing them into the chat, and we can ask the physicians those specific questions that you have. So what we're finding is that people in general and physicians are really not satisfied with the healthcare that they're able to provide patients. It's basically a sick care industry. And what we're talking about tonight is preventative healthcare and the technology that we provide that affords you the ability to practice preventative medicine. And so we think, especially coming out of this 6 weeks of quarantine, that there's going to be a huge demand from patients for health and wellness, and kind of a different paradigm to how their care is received. So there's not really been a lot of satisfaction with preventive healthcare. That it really hasn't been profitable for physicians. Reimbursements are declining, so physicians are unsatisfied with what they're being paid. They're having to see more patients and spend less time with their families, and so they're unsatisfied with their lifestyle as well. So we have a way that we believe that we can help physicians improve healthcare. Like I said, there's going to be a huge shift to prevention and wellness. What we're seeing with the current situation is that those with comorbidities and have underlying health issues are more susceptible to this disease, and in general, most diseases that come about. So a few things that we do know: diets are inadequate. Most people aren't getting the proper nutrition. They're not eating the adequate amounts of fruits and vegetables to kind of protect themselves and get the most nutritional value and nutritional status for their body. There's a huge demand for supplements. The last numbers that I saw is about $40 billion in the US annually, and it's growing about $1 billion a year. And so I mentioned that we have a better solution. We have a scientific way for physicians to monitor their patients. They can use the scanner to get a baseline measurement. and then scan their patients monthly after recommending a nutritional therapy. So we have a great solution. The company that stands behind us is a phenomenal company. They're rated 5A1 on the stock market. They were rated one of the most trustworthy companies in the US by Forbes magazine. They have 85 scientists that work 85 scientists that work full time for the company. And we have a way to help physicians add an additional profit center to their practice that they may not be providing in an additional service for their patients. So how do we know our supplements are working? That's kind of the million-dollar question. Most people are just going to go out, pick supplements up off the shelf at their local GNC, Target, wherever they get, do their shopping. But there's really no way for them to know whether or not their supplements are being absorbed into their body. And that's ultimately why we're taking supplements. So we have a device where we're actually able to measure the efficacy of the therapy. So as I mentioned, you can take a baseline measurement, charge the patient for a fee for the scan, and then also make a residual on the supplements. We have over 85 peer-reviewed articles validating the science and the technology. So we have kind of all three components that make a product successful and viable. We have the science, we have the technology, and we have innovation. So it's really an accountability technology. It creates behavioral change within your patients. There's a readout that they'll see while they're being scanned, and it'll tell them whether they're low or whether they're at adequate levels to protect themselves from, potentially protect themselves from disease. So it's a quick test. It takes 30 seconds. It doesn't need to be administered by the physician. You can delegate that responsibility to somebody else in the office, whether it's an MA, a PA, or somebody at the front desk. It's portable. It's battery operated. It only needs to be charged once or twice a week, depending on how many scans you're doing. And based on over 23 million scans that we've done, we know that 94% of patients in the US are going to fail on the test. However, we do have a 99% response rate to our nutritional therapies, so it's really a win-win for everybody involved. So what do the results mean? This is kind of the readout that the patients are going to see while they're being scanned. We really want everybody to be in the 50,000 range and above, the blue or the platinum. But as I mentioned, 94% of the population in the US is going to score in the green or below. And interestingly enough, 80% of Americans are going to score in the orange or the red. So in the orange, those will be patients who are on the standard American diet. We call it the SAD diet. And then your chronically ill, your diabetics, your cardiovascular disease patients, and other chronic illnesses are going to be down there in the red. So we have a measurable difference. We can actually measure that our products are working, that they're being bioavailable to the patients, and then we can rescan those patients on a monthly basis just to show them that the products are working, which helps with retention and compliance. So they're more likely, if they're seeing their score increase, they're more likely to stay on take the nutritional therapy as recommended and be more compliant. So as I mentioned, the chronically ill are down in the red, your average American is in the orange. On our baseline product, Life Pack, we can get patients up into the green range. And then our Life Pack, in addition to another product that uses a anti-aging technology that's proprietary to PHARMANEX called Age Lock, we're able to get patients up into the blue range. This is just a little bit about the Age Lock technology. So on the left, you see a gene chip of a young person. On the right, you see a gene chip of an old person. With our Age Lock technology, we're able to take 94% of 1,000 genes that are responsible for aging back to a more youthful expression. So, your older patients who are concerned with aging gracefully and being able to still do the activities that they want to do, this is a really great product for them. So as I mentioned, we have 85 peer-reviewed articles. This is just one validating the technology in the skin carotenoid score out of, I believe this is out of Yale. So spectroscopic evaluation of skin carotenoids is a biomarker of carotenoid status for human studies. It basically says that skin carotenoid score is as good, if not better, at predicting carotenoid antioxidants in the system than blood serum testing. Here's another study. It's a breast cancer study out of Harvard that high levels of carotenoids are backed for breast cancer risk reduction. So we have some, those are just two studies. We have studies for just about every specialty. If you do a search on PubMed, there's thousands, hundreds, if not thousands of articles linking high antioxidants to disease mitigation. So that's just a brief overview of the technology, a little bit of the science. I would encourage you, if you see the value in this for your practice and what it can do for your patients in practicing preventive medicine and the value it can provide to your practice. From a financial perspective, I encourage you to reach out to whoever invited you to this call, and they can give you some more detail on the science and the technology and get you any studies that you would require to validate this for you. So I hope that makes sense to everybody. At this point, we're going to switch over to the testimonials from our physicians. We're really lucky to have them here with us tonight. Fortunately for us, we're in a place where everybody's kind of stuck in their homes and aren't able to practice. So it's very difficult to get these physicians on calls. So we really appreciate them getting on and speaking to everyone about what this has done for their patients and their practices. So Michael Cook's gonna take over here. He's gonna do an introduction on the physicians, and then we're gonna hear from the physicians.
Thank you, Dan. There's a great summary of a lot of information in just a few minutes. It's tough to do that because we do have so much information to share. Our first guest this evening is Dr. Andy Feltz. He's been working with us for about 2.5 years. He's a doctor of optometry. He's the founder and clinical director for 360 Cares, the largest mobile healthcare company in the United States. Founder of On-Site Wellness, where he successfully implemented this technology in many healthcare practices. Serves on the board for Mission of Sight nonprofit, travels yearly to assist the people of Jamaica. And he's also the head varsity basketball coach at St. Francis High School. And a good friend of mine. I don't see how he gets everything done. He's a highly motivated individual and an entrepreneur. So Andy, how are you doing?
I'm well, Michael. How are you?
I'm great. So tell us a little bit about how you were introduced to this and how you use it in your practice. And you just use it for optometry, or do you also use it for wellness in general?
So sure. No, first and foremost, I was. Thanks for having me on tonight. I was happy that you guys thought I was worthy to come on and share a little bit about my experience with the scanner and the PHARMANEX supplement line and how I've been able to help my patients with the technology. So I was at our national convention, the American Optometric Association convention in DC a few years ago, and met a gentleman, Lawrence Cassini, who I think we'll hear from later tonight, who was instrumental in impressing on me the importance of preventive medicine and the scanner technology. And I went over to his booth and got tested, and just immediately fell in love with the science and the technology. Optometry in general, we're kind of little gadget nerds. We like our little toys, and this one, as soon as I saw it, I was like, I got to have one. And it's been even better than I expected in practice. So, originally my intent was to use it for macular degeneration. It's a big part of my practice, dealing in geriatrics. It's the #1 cause of blindness in the Western world, and it's a big issue. If you make it to 75, 1 in 8 of those individuals is going to lose significant portions of vision from macular degeneration. So, and it's a devastating disease. So I felt like this would be a great way to manage it better, because we've been throwing out supplements. We have no idea if they're even working. And now I have a technology that tells me, you know, a baseline, and then if the patients are improving in that score, then we know that they're absorbing the supplements that we're giving them. And macular degeneration is a little bit unusual, and that's the first outcome-based disease, you know, outcome-based studies that show that supplements were helping a disease. So that's kind of a cool thing. But I've morphed it more into a whole body health and wellness and prevention tool. You know, most of my patients are like me; they're about 50, and they don't have macular degeneration yet. You know, it's only about 5 or 6% of my practice. So the majority of my patients are in a regular practice, you know, more like my age, and they don't want to get it. They don't want to get sick. They don't want to have eye disease. They want to perform at their best. And this device allows me to open that door where before I would talk about it and it was abstract. Now I talk about it and it's concrete.
Very good, very good. So what impact has the score had on your patients? And that when they see that that score on the iPad, which is wirelessly connected to the scanner, what kind of expressions come on their face, and what changes do they make in their lives?
Yeah, and I'm glad you brought that up, because it's not just the score; it's the visual of it. The readout on the iPad is really important, because the color wheel, there's a psychology there where the people get it; they understand how that works, right? It's a gas gauge, and they get colors, and so it is impactful. And I've seen it be a behavior change agent. You know, I've seen the impact of it on my patients. They want to move their score up. It gets competitive a little bit, which is fun. So anytime you can make things sort of like a game, you know, people want to compete and they want to get better at it. So that's been great. The impact has been that, you know, as I talked about nutrition my whole career with my patients and how important it was for eye health, it wasn't real to them. It was just a discussion on things that are kind of just, you know, oh yeah, that'd be a great idea. But as soon as you give somebody a visual of where they currently are and where you want them to be, and then tools to move it, they'll get to work. Now, not everybody, but most patients use this test as a behavior modification tool.
I see.
And they love to get retested. That's the fun part, is when the first test is great, the second test is even better.
I agree. So one of the questions that I have with your background, entrepreneur and obviously a physician, you've got to be into the science. At what point was the validation that, you know, I mean, this is kind of Star Trek. And when I first presented, I know that I get a lot of looks like, are you serious? And usually the 10-year study from Yale University satisfies that. But what was it for you that validated the device?
Yeah, so a couple things. The Yale study was great, but that's only one. Lewis Cady's white paper, Dr. Cady's white paper was great. I got to tell you, when I went to the company headquarters, for those of you who are new or don't know, we host a preventive medicine healthcare alliance forum at PHARMANEX's headquarters in Provo, Utah, you know, a few times a year. And that really sealed it for me, because I got to meet some of the PhDs that are, you know, working on the supplement lines, some other healthcare providers who've been using the scanner for multiple years. And that, you know, and obviously the company's commitment to excellence with their facilities, that really sealed the deal for me. And from after that, I was all in, not only on just getting a unit, but, you know, promoting it.
Sure, sure. Well, thank you. I think that's a great lead-in to Dr. Cady, who is our next speaker. And as Annie said, he wrote the white paper on it, and he revised that in 2017. Dr. Lewis Cady, here's a little information about him. He straddles the world between science and art. He trained first as a classical pianist. He went on to obtain 2 degrees with honors from the Conservatory of Music at the University of Missouri at Kansas City, before obtaining his medical degree in 1989 from the University of Texas Medical Branch in Galveston. He then trained in psychiatry at the world-famous Mayo Clinic, beginning his practice of child, adolescent, adult, and forensic psychiatry in Evansville, Indiana in 1993. In addition to his conventional medical training in medicine and psychiatry, Dr. Katie has subsequently received additional training in age management medicine from the Synergenics Medical Institute in Las Vegas, Nevada, adding that modality into his practice. And his practice is at the Katie Medical Center, or Katie Wellness Center. So, Dr. Katie, how are you this evening? And tell us how you were first introduced to this and how you've implemented it. And I mean, there's not enough time to go into everything, but we sure look forward to hearing from you.
Hey, Mike, I don't see him. I think he might have dropped off. They might have had a bad connection.
Did we lose Dr. Katie somewhere? Okay. All righty. Well, let's see if we can get him back on in the next few minutes. Then, in that case, let's move ahead to Dr. Scott Sanderson. Dr. Sanderson and I met actually on LinkedIn last year, where I introduced the business to him. He is an MD. He attended the University of Washington School of Medicine, and then did residency in emergency medicine. He worked as a flight surgeon and emergency medicine physician when he graduated residency. He became interested in age management medicine when he realized, it's hard for me to believe this, that he was on a bad trajectory regarding his health after he graduated from medical school. He said he was overweight and out of shape, started an age management medicine program that saved his life. He started to really understand how powerful it could be for people to optimize their health. And now he's in better shape and feels better than he did when he was 25. Looking at him and knowing him, I've just known him less than a year. I met him at the symposium, Head of Healthcare Forum symposium we had in January at our innovation center, and I tell you, he's in top shape. So he's certified in age management medicine. He opened a practice in Honolulu, Hawaii, where he seeks to help people live fuller and longer lives through optimizing their health. So, Scott, could you tell us a little bit about how you reacted when I sent you a message and some information about this device, and what were your thoughts about how you could integrate it into your practice?
Oh, hi, Mike. Hello, everybody. Can you hear me all right? I've got a new headset here that I'm testing out. And
Yes, we can.
Okay, perfect. Very good. All right, happy to hear that. Yes, I'm happy to be here today and happy to help people learn about this device. It's a great device, and I really like how it fits into my practice. So, yeah, believe it or not, I really was on a bad trajectory with my health when I was about 37 years old. I was overweight, out of shape, dead tired all the time. And so I kind of was my first patient in the age management practice. I started that, and that is going well. But then Mike had reached out to me, and sort of serendipitously, I had just read David Sinclair's book, Lifespan, which he's one of the foremost age management experts in the world, or anti-aging experts, I should say. Done a ton of research, but he's speaking a lot about epigenetics. So the age-lock youth really got my attention with that, and looking at the gene chip card and how it modified that in the same way that calorie restriction does, it blew my mind. So it really got my interest, and I started looking into the rest of the company and everything, and looking at the scanner. Just kept getting more and more interested. So I started kind of doing searches on my own, with antioxidants, and I understand the power of good antioxidants, and but I also understand some things about supplements. I've had some of my own supplement lines, and the quality is always an issue. So reached out and started talking to Mike about the device, watching some of the lectures about it, doing my own literature review, and then went to the conference in Utah, and that really kind of solidified everything for me. And to see this facility is an amazing facility, and I also feel it gave me the feeling really that this company really has an actual mission, not just a company that's there to sell supplements. They're constantly evolving and developing their products, which you really just don't see with most other supplement companies. They kind of do a set it and forget it. Once they get a formulation, they'll make something and then that's it. But PHARMANEX is constantly trying to improve their products, and the facility was amazing. The labs were just terrific, and the equipment that they use is all top notch. But then meeting the scientists and hearing directly from the scientists who have done the research in this field was fantastic. Really solidified everything for me. And so for me, you know, a lot of what Dr. Phelps said, I've definitely felt with my patients. When you scan somebody, and I turn the iPad toward them, I let them watch so they can see this coming up. It's so much better than me just sort of lecturing them and saying, oh, antioxidants are important and this is why. And they're kind of like, yeah, okay, doc, thanks. But when I show them, objectively speaking, that they have a low level, it really gets their attention. And I've had people actually tear up in my office when they saw how low their level was. It really, really gets their attention, really gets them to take action. I explained to them that it's basically like a similar technology to a pulse ox, which they're generally familiar with. And they understand that that can measure the oxygen level in your blood. So they understand how this kind of measures carotenoids. And then they see that level. And then, yeah, it definitely gets their attention. So my patients have all reacted very well to it. And honestly, I don't know for sure how it is. I think it's probably similar in other states, but here, primary care providers are just getting slaughtered with decreasing reimbursements. It's horrible, and it's only getting worse. So I honestly after researching everything and seeing all this, I made the decision that I would like to help other providers come on board with this and to basically get one of these scanners in as many offices as possible. Because I believe that every primary care provider, especially, and then dentists and optometrists, everybody can benefit from having one of these machines. And they can, you know, they get to help their patient to be more healthy. Of course, that's number one on all of our lists. We get to help them avoid heart attacks, strokes, cancer, and just to feel better every day. And then also, you know, your patients are out there and they're buying products from all sorts of crazy unknown sources. You know, the New York Attorney General did a test on a bunch of products from GNC, Walgreens, Walmart, Target, and found that 78% of them didn't contain what they said they did. The quality controls are just junk. So your patients are out there taking these things. So the patients understand that supplements can benefit them, but they don't know where to get a good source of them. So you can provide that to your patients as well. So you can help your patients avoid taking junk products, make sure they're taking good quality products. And then for a primary care doc that's getting slaughtered by these reimbursements, I feel like this secondary revenue stream, which by the way is really nice because you don't have to do it. Your staff can do the scanning for you, and then your patient can come in and you can go over the results with them. So it's not an additional draw on your time. But then when you have this a little bit of additional revenue, and it can be substantial if you want it to be, it helps you to be a better doctor overall because you get to spend more time with your patients. You can slow down. You don't necessarily have to see 10 an hour just to keep the lights on. So that's why I really think that this product, this device could be so great for so many primary care, so many dentists, basically all providers. So obviously you can see I'm excited about the device. I enjoy using it. I really like pulling out and showing it to some patients. I scanned my kids, and it actually got my kids to start asking for vegetables. You know, we could go out to a restaurant and my 11-year-old son said, "Dad, can I get a salad?" I was blown away. But he did not like his score. So, I mean, if it can work on an 11-year-old kid, it can work on about anybody, I think. But do you have any questions for me about my experience, or have I said enough?
You know what? No, that's great. Like you said, that's anytime you get an 11-year-old to ask for vegetables, that's a good step forward. I want to put you on the spot though, just for a second, and ask you, okay, in your medical school training, how much nutritional training did you have in medical school?
Basically, you sum it up with a statement saying, if people are heavy, tell them to eat less. That's about it. Honestly, there was very little on nutrition, very little on exercise. And looking back, it's sad. Basically, everything that I've learned, I've had to do afterwards on my own. You know, and it's so important, and to realize how much it affects everything. You know, sometimes I feel like when I tell people all the benefits of antioxidants, like I kind of feel like I'm talking about almost like a snake oil. because you tell them that it affects their vision, it affects their skin, it affects their nerve function, it affects their brain, it affects their heart, and all these things. And like, okay, wait. But when you think about the mechanism, the fact that it mitigates cellular damage, then of course, anything that's going to mitigate cellular damage is going to have very wide-ranging effects, and it's going to help every system in the body function better. And so, but of course, yeah, definitely nothing about vitamins. I mean, we talked a little bit about vitamin deficiencies, but it was always in the setting of pathology, never anything preventive, honestly.
So when you decided to look into nutrition, and step outside the pharmaceutical box that most physicians are trained in, nearly all, were you surprised at the amount of studies and things indicating that how much nutrition can affect our wellness?
Yeah, I think that it really was. My view of how to be healthy has really changed a lot with all of this, and I'm much more proactive with my health than I was 10 years ago, and I eat very differently. That was a lot of why I was so unhealthy previously, but yeah, there was nobody saying that. It was kind of, because it's a different model, I believe. So I say there's sick care, which is what I was trained in, and then there's health care, which is what I'm trying to practice now. The sick care, we were trained to wait, and if somebody comes into your office and they're not sick, you say, okay, thank you, we'll see you later, so if you don't have high blood pressure, we're not going to do anything for you. If you don't have diabetes, we're not going to, just nothing, just leave them on cruise control. But with healthcare, a true healthcare, you're addressing problems, before they happen. You're trying to mitigate these things so that it doesn't ever happen. It's just a very different way of looking at things. And yes, I was trained in that traditional model of sick care. And now I see it feels very flawed.
Well, bravo for stepping outside of that and learning and implementing implementing wellness into your practice, because I know the overwhelming number of studies show that once a patient is on a prescriptive product for a preventable disease, they tend to stay on that product for the rest of their lives. And we all know that those drugs have side effects and can lead to them being on other medications. So thank you for your dedication to your patient. Thank you very much for your time this evening.
Of course. Happy to be here.
So I want to see, did Dr. Katie, is he able to join us? Does anybody know? Has he made it back to the call?
I don't see him on here, but there's a couple of just phone numbers.
He's actually trying to get on. He had a problem, but he's trying to get on.
Okay.
Okay.
All right.
Want to move on to Tanner, and then we can get to Dr. Katie?
Certainly.
Hey, guys.
Hey, Tanner.
Oh, there he is.
There he is.
Just like to introduce you. You spoke a little bit just in the beginning, saying hello to everybody, but I want everybody to know that Tanner Gibb is a bilingual scientist. He was a professor at BYU, and he's been with our company for over 10 years. First as a product support specialist, and he's currently a technical communications officer and an educational support specialist. And he's put a few very technical videos together on the products. It's not necessarily geared for the consumer, but for physicians to understand what we put into them and what they do. And it's an absolute pleasure that he's available to us tonight, and hopefully for some questions following up. Tanner, you there?
I'm right here. Should I share my screen here?
Awesome. Yes, you can.
Okay, I got a few slides. Host disabled participant screen sharing. So if we could unlock that, that'd be great. Thanks for the intro. I love what I do. I love the company that I work for in PHARMANEX R&D. Work with very smart people every day, so it makes my job easy.
Dan, are you able to unlock the screen share for Tanner?
I'm working on it. I'm not sure exactly how to do that. Give me a minute.
No worries. Well, just a few comments before I jump into my part and talk a little bit about PHARMANEX and some of the products. There was a comment about nutrition. When you think about diets in America, they're not very good. The average intake of fruits and vegetables is actually 2 to 3 servings per day. And that's when you include orange juice as a serving of fruit, which in my opinion shouldn't count. It's more sugar water with added synthetic vitamin C, because the vitamin C and other nutrients in juices are typically not stable. We have experience in juice products as we have one that we sell currently.
Yeah, I agree.
Also, in terms of diet, I was reading an interesting paper just the other day. It was published in JAMA in 2018 about risk factors of mortality and how it relates to, diet and wellness. And, oftentimes when we think about, what's killing us in America, we often point to, high cholesterol or high blood pressure or smoking or obesity. But the number one risk factor in this paper was actually poor diets. And they estimate that it contributes to over 500,000 premature deaths each year in America. And what's sad about that is you look at, as far as that risk factor is concerned, that's something that's entirely preventable. And that contributes to about 80% of cardiovascular disease. So in terms of poor diets, we're not doing a very good job. And what's interesting about that is you look at industry, you look at science, you look at governments, they've been encouraging us to eat well for a long time, right? To eat our fruits and vegetables, get our whole grains, get our lean protein, but we're not doing a good job. And the data shows that. And even when you look at deficiencies of certain vitamins and minerals, it's actually a global epidemic when you look at vitamin D and vitamin E. Not just according to me, but according to published papers of experts in the area. Over 90% of us are deficient in vitamin D, and that's just minimum standards, right, to prevent deficiency disease such as rickets, for example. If you don't get enough vitamin D, there's actually an optimal level of vitamin D in the body that's actually much above what 100% of your daily value is. But there's deficiencies across the board, from vitamin D, vitamin E, vitamin C, some of the B vitamins. On the mineral side, we're typically very deficient in calcium and magnesium, and those are actually some of the more bulkier nutrients that take up a lot of space. And so typically in your one-a-day multivitamins, they're not going to have near enough or any of some of these essential or bulkier nutrients, much less using bioavailable forms. And that's actually one of the reasons why PHARMANEX started, is we saw, it'd be great to get all the nutrients we can in a perfect diet, but really nobody has that perfect diet. And you look at studies of tens of thousands of people, we're deficient across the board. And what's interesting about these deficiencies is that many times people don't notice in the moment that they're deficient in a certain vitamin or mineral. But there's a theory in aging called the triage theory. It's actually by Bruce Ames. He's a PhD, studied nutrition and anti-aging and other areas of health. But he's postulated, and there's good evidence to back this up, that nutrients, they work in the moment for survival at the expense of what a nutrient could do for you long term. So for example, if you look at vitamin K, there's about 13 vitamin K dependent proteins in the body. And if I divide it up into two major functions, vitamin K serves to clot your blood, but it also serves to support bone health, right? It's a transporter protein for calcium. And so the bottom line is that there are studies actually in mouse where they'll knock out certain proteins. And if you knock out the ones that are important for coagulation, it ends up being lethal. Because that's where the vitamin K wants to be used in the moment. And you think about it, if you get a cut, you want the vitamin K to clot your blood, to keep you alive, to survive. But that's at the expense of long-term health and wellness, where if you're lacking that vitamin K, your bones might suffer in the long term, and you might have increased risk of osteoporosis and fractures and other bone-related disease. So there's other examples of that as well, with certain B vitamins where they play a role in energy and DNA protection, right? They're going to give you energy to keep you alive at the expense of maybe protecting your DNA from, free radicals and other oxidants and other damaging compounds and toxins inside the body. Calcium, another good example. Calcium is actually meant to be inside the bone. Over 99% is in bone and teeth. Only 1% or less is in serum and blood. But it goes to support, brain health and muscle health. It's involved in neuromuscular contractions and keeping you alive, right? You want your muscles to contract, and so calcium is part of those channels to stimulate that process. But the problem is that, if we're stressed or if we're even marginally deficient in calcium, it's going to be leaked from the bones to be able to support that immediate need at the expense of long-term health and wellness. And so when I talk nutrition and why it's so critical, I really emphasize why nutrition now and prevention is really the main benefit. Even if you don't notice the benefit immediately, in the long term, your body will thank you. So with that, let me see if I can share my screen. Yes, I can now. Perfect. Let me pull it up. have just 7 or 8 slides here to talk about some of the science behind PHARMANEX and just touch on the scanner, but some of our products, and mostly highlight just why we're different, because we realize there's many supplement companies in the world, and so why us, right? PHARMANEX, just a bit of history. We were founded in 1994 and acquired by Nu Skin in 1998. There were some other companies bidding for PHARMANEX at the time. Joe Chang was leading the way. He was the head scientific officer and is today in our company. He was actually a founder of PHARMANEX along with Michael Cheng and Carl Gerasi. They had extensive experience in the pharmaceutical world, developing different anti-aging drugs, if you will, anti-rejection drugs. And they saw that there must be a better way to bring some of the science of pharmaceuticals without all of those, all of the time and all the money and all the drug process. They said, you know what, these plant compounds have a lot of incredible health benefits and properties to them. And so they wanted to employ some science-based nutritional supplements using the right part of the plant, doing testing on those plants, making sure that we have the right level of actives that support certain health benefits inside the body. All about being the difference demonstrated. So there's a success quality process that I'll touch on here briefly. And innovation is kind of the core behind what we do and why our products sell. Originally, PHARMANEX was based as a brick and mortar company. There was over 30,000 stores that sold these products next to all these other supplements. And it was profitable at the time. But as soon as we changed to this model of getting away from products in stores and giving it to our consumers and to our sales leaders, they were able to sell the product a lot better and not compete with the store model. And our sales have increased steadily ever since. And today is a very profitable part of Nu Skin. Usually makes up about 40 to 60% of the revenue, depending on the year. Typically, recently, it's been about 35 to 45%. But when you think about a $2 to $3 billion company, that's bringing in a lot of revenue for a purchase that was about $130 million back in 1998. So that being said, PHARMANEX and Nu Skin together, we have an incredible team of scientists. So at the head is Joe Chang. Mark Bartlett is the VP of PHARMANEX. Helen Naggs is the VP of our skincare line. But we have a whole team of other scientists. We have more than 75 in Espanol, as you can see there. But, you know, all these other scientists behind the scenes, you don't get to see a lot, but, you know, they're working in different areas of science. And, you know, we have dermatologists, we have pharmacologists, we have pharmacognosists, we have chemists, we have physicists, we have biologists, we have nutritionists. I mean, you can think about a PhD that would be important for making a supplement. We probably have either one or more PhDs with those degrees inside of our company. And we actually believe that that's one of our competitive advantages. We also have a scientific advisory board that we meet with on an annual basis. They're not just members of a board that sit there and, you know, are good names to us. We actually interact with them and they give us great insights and ideas into what they're doing. We work with dermatologists who actually help run many of the clinical studies that we do on our skincare side. We have experts in anti-aging, in genetics, in plant compounds and pharmacognosy, in many different areas, actually in future areas that we're looking at for gut health and how that impacts the body. So it's just an incredible team of scientists that we work with. We have a success quality process. And to me, this is really what separates us from the crowd. Because, and maybe I'll share just a quick story here. There was a pretty negative experience in the supplement world that happened in January of this year. I don't know if you've heard about it, but there were over 1,200 branded supplement products that were recalled because a large-scale manufacturer of dietary supplements that made products with all these different brands that were selling them in the marketplace, they had to recall those products actually for the last 7 years because of several violations related to quality, to potency, to identity, to good manufacturing practices, in addition to violations on claims made to supplements, and the list goes on. And so we were proud to say we weren't part of that group. And part of the reason for that is this success quality process. And what I'll get to next is our world-class quality team. So the success process begins with selecting good quality ingredients from good sources around the world. So we know that in order to have good products, you have to select the best ingredients. So we look at the literature, we look to see what are the right ingredients at the right doses that are going to make a difference in the lives of people who take them. Sourcing makes a big difference. A lot of people and a lot of consumers don't really know this, but you know, sourcing variability is a big deal, and that's why we invest in our testing and our labs and what we do. Just give you random example, in one of our products we sell called Age Luck Youth, we looked at sources of purple corn, which is one of the potent ingredients inside the product. We got sources from Peru, from the United States, and from China. And the vendors all told us similar things in terms of potency and quality. But when we tested them in our labs, we found there was a very big difference in terms of just the level of actives, the level of what they call anthocyanins. These are some of these plant pigments inside of purple corn that give some of the bright purple color to it, that are responsible for some metabolic benefits and some other health benefits inside the body. But the bottom line is that's why we evaluate sources, and we pick the one, that's grown in the right way, that's carefully processed to be able to maintain the actives that we care about that provide these kind of benefits. Specifications, we have very strict specs. In fact, we're one of the strictest that I'm aware of in the industry in terms of specs that we have on our raw ingredient and on our finished goods. So these are specs that include things like heavy metals, total bacteria count, E. coli, Staphylococcus, Streptococcus, yeast, mold. We look at moisture. We look at packaging. We look at weight. We have weight specifications. I know a lot in the industry will just have a minimum weight or a weight range. We actually have a minimum weight to be able to guarantee the potency of all the ingredients in our formulas, so that what you see, even at the end of shelf life, we can actually guarantee that based on the specs that we have, in addition to the stability testing that we do. So we actually do accelerated stability testing, where we put a product in a chamber in higher temperature and humidity, and it depends on the region what exactly that is. But for the US, it's higher than normal temperature and normal humidity to estimate how it's going to respond over the course of a year or two. And then we do real-time stability testing as well, where you put the product on a shelf for 2 years in normal temperature and humidity, and then you test the product after those 2 years, and you test all of the compounds, you test for contaminants, to make sure that it has 100% of all those ingredients and that it still meets our specifications at the end of shelf life. I can tell you here that if our product doesn't meet all those standards, what we'll do is we'll actually put in what are called overage amounts of certain ingredients. So these aren't claimed on the label per se, but it's an overage amount to compensate for any degradation of certain nutrients, for example, like vitamin C, folic acid, some others that aren't very stable in complex formulas. We put a little bit extra to guarantee what you see on the label, even at the end of shelf life, all while considering safety, upper limits, and all of that. So standardize, this is one of the things that separates us from the crowd as well. We standardize all of our products, whether it be to the ingredient itself or to the level of actives in that ingredient. So a good example of this is green tea. We sell a Tea Green 97 product. There's many green tea products in the marketplace. And if you were to ask, why would I pick PHARMANEX's green tea over the thousands of others, perhaps that are a little bit cheaper? It comes down to quality and standardization. So we standardize our green tea to 97% polyphenols. These are the active compounds inside of the green tea plant that provide the benefits. Specifically, we have the right ratios of total catechins and EGCG and the other type of important catechins that are naturally found in the green tea plant. So we actually hand pick ours. It's picked during a certain time of the year when it's not too mature. If you actually get green tea leaves that are too mature, then they lose some of their potency and some of their actives. And so we've learned a lot of this over the years, and that not only applies to our green tea product, which is also decaffeinated, very safe, very pure. We standardize to these active compounds in plants, making sure we're using, whether it be, the leaf or the stem or the root or whatever part of the plant that makes sense, we standardize to those actives that are providing benefits. Safety is a given. Maybe one thing I'll mention here is there was a story on a TV show about a certain ingredient that actually didn't have good safety, but was touted as this fat burner miracle inside of a bottle. And a lot of consumers got back to me and got back to the science team and said, hey, you need to get on this. You need to start selling these raspberry ketones. It's just this magic ingredient, miracle for weight loss. I looked at the science at the time. It wasn't proven to be safe. And there was one study in mice in China where they gave them a human equivalent of pounds of this ingredient. And so, in my opinion, it was actually toxic and unsafe, which actually led to the weight loss in this particular study. But because it was promoted on this TV show, everyone started to buy it. And we questioned the safety, we questioned the efficacy. It's just a good example of where a lot of times consumers just, they see something on Google, they don't really understand, but they want to make sure that whatever they take is safe and effective. And that's why we have this quality process and screening process for every ingredient that goes into our formulas. Substantiation, it's another key thing. We substantiate all of our products, all of our technologies. mean, the scanner is a classic example of that. The scanner actually began, way back in the day. It was a much larger device. It weighed a lot more. It was a lot slower. We've innovated over the years and created an incredible device that's fast, that's digital, that measures a class of antioxidants called carotenoids. There's over 700 in nature. There's about 20 that you can detect in serum that are important for health and wellness. But you look at the literature surrounding that, and we're really impressed with how we substantiate the science there. There's over 100 peer-reviewed articles that validate the technology behind the scanner. Many of them use our device. There's some other devices not in our space, but that are used for scientific proof. And I can tell you a lot of these studies, they use this device as a motivational tool, and they use it as a biomarker of fruit and veggie intake, because we've learned over the years that people tend to overestimate how well they think they do in terms of exercise or diet, right? We tend to overestimate our actual fruit and veggie intake. And that's what's so incredible about the scanner, is that we have testing showing that it correlates to fruit and vegetable intake. And that's the best biomarker of just a lot of these internal benefits that we talk about. So world-class quality team. I just talked about the 6S quality process. That's more in terms of the product development. But we also have a quality team that makes sure that we don't have these kinds of recalls or these kinds of issues as it relates to, purity, identity, claims, and all of these other things that go into creating a high quality company and quality supplements. Maybe one thing I'll mention here is we have an entire team of quality engineers that don't get a lot of time a day, but they're more behind the scenes. These engineers, they actually do an audit of the manufacturer before we actually work with that company, to make sure that they have the specs in place, to make sure that they can run things in the proper way, in the proper order, and make sure that they can have the proper documentation from how they receive the raw ingredients, to how they're blended, to how they're mixed, to how they're dried, to how they're packaged. We actually demand documentation along every step of the way. Another aspect of quality, we actually have an entire complaint team that dedicates to customer complaints that we get across the board globally. And I can tell you, we don't get many, but when we do, we investigate it fully. So we look at, what happened, why did this happen? For example, why did a product leak? And we make sure that that doesn't happen again as we improve the quality of our products. We actually have a safety committee team as well, where we actually look at trending of our dietary supplements and how safe they are. And if there's any kind of weird trend that spikes on our radar in terms of some kind of adverse response, we look into it, we evaluate, and we make necessary changes in terms of, recommendations on the label or changes in ingredient sources or whatever that might be. So I'm actually part of that committee, and we look at it. I can tell you across the board, in terms of adverse responses that are reported for our supplements, it depends on the product, but it's usually less than 1 in 1,000. So in terms of safety, that's actually an incredible thing. And these are reports, it's actually not causality. I've talked to a lot of people who say that a supplement might be causing some kind of side effect, but oftentimes it's actually caused by something else. I always recommend just, going off, taking a break. A lot of time it's just the psychology of taking something new, and then wait till the side effect goes away and then reintroduce, because better nutrition just improves health across the board, and our products are well tolerated. And that's because we're using quality sources of ingredients, safe sources of ingredients, safe amounts of ingredients, and all the purity testing that goes into our products as well. Maybe just a random note here about purity, because this goes into the quality. We have some of the strictest specifications in the world when it comes to purity. So our fish oil that we use comes off the coast of Peru. We actually use Peruvian anchovies. It's our primary source. The reason we use that is because they're really high in EPA and DHA, in addition to be very small fish. Small fish are usually less contaminated than the medium or the large fish, and they also don't live a long time, right? So they don't have a long time to bioaccumulate different toxins. Our fish oil is tested for a number of different compounds and contaminants. There's actually over 600, and that's an underestimate of where we're at. Heavy metals, DDTs, dioxins, other toxins. In terms of heavy metal testing, we don't share our exact specification. It's kind of a legal concern, and even in the industry. But what I can tell you is that based on our specifications on the mercury, which is a major concern for fish oil contamination, our allowable minimum specification is 100 times less than actually what's allowed according to European regulations. And Europe has some of the most strict regulations in the world when it comes to contaminants and heavy metals. So just to give you a brief idea of some of the purity and the quality that goes into our products. So we have an innovation center. That's actually where I work in Provo. We have another innovation center in China. And we have state-of-the-art labs where we're doing testing on a regular basis. We actually test all of our raw ingredients and our finished goods. And then we actually require our manufacturers to do testing on the finished good. And our quality assurance team actually has a review and an analysis of that test to make sure that it meets all of our specs before we actually release it into the industry. So you know that every product you buy has actually already gone through that purity, the identity, the ingredient testing to make sure that it's safe and effective for our consumers. But the lab testing is more of an exploratory-like test to make sure that we can validate the safety of the ingredient before we put it in a product. So when we test raw ingredients, we look at how it's going to act in a formulation. We look at stability. We look at microbiology. So does it meet our specs for E. coli, for total bacteria, and other things like that? We have a clinical lab as well, where we do a lot of clinical testing, mostly on the skincare side, but also some preliminary clinical testing on our PHARMANEX. And then a chemistry lab as well, where we analyze the compounds for the active ingredients. If you can hear the screaming in the background, that's my little 3-year-old daughter who happened to sneak down here and wants me to play some basketball with her. So these are just some of our top PHARMANEX products. And with this, I'll close here because I've gone a little bit over my time. I could talk all day about who we are and why we're different and what we do. But just over on the left there, you can see we have a LifePak family of products. LifePak Nano is kind of our premier one. It has fish oil and krill oil. We have nanotechnology with proven differences. So we use a nano CoQ10, which absorbs at least 5 to 10 times greater than typical soluble CoQ10 inside the body. Nanotechnology is where you actually wrap the ingredient in cyclodextrin. It's a fat and water loving ingredient that helps with dispersibility of the ingredient. One thing I will mention is we're actually working on new and even better technology for an update that we're looking at LifePak Nano, hopefully for Q4 of this year. So stay tuned. In this update, we're actually updating our LifePak line as well, and updating a new product called LifePak Elements. It's going to be an introductory LifePak product, but without the pill. So it's going to be a powdered berry mix-in with some updated nutrients. We're using some methylated B vitamins, so the methylfolate, methylcobalamin. We're adding choline to our multivitamin. Choline is a very important nutrient for liver health, for muscle function, for brain health. You've heard of acetylcholine. It's a neurotransmitter. In any case, over 90% of us are deficient in choline. Super important for us, and especially for pregnant moms as well. As they're taking a product, they want to make sure they get that adequate level of folate, of vitamin A, of some of the B vitamins, of choline in the body as they start that process. So a lot of exciting updates and changes happening on that side, in addition to a line of what I call booster nutrition products. So these are going to be smaller products that you can boost or take as a standalone. For example, we're going to have a vitamin C and zinc standalone product. We're going to have a vitamin D standalone product from shiitake. Most vitamin D in the marketplace comes from lanolin, so ours is going to be a unique and novel source. We're going to have a magnesium product. We know magnesium deficiency is a big deal. You're going to cover most of those needs with a LifePak, but maybe someone can't afford one of these products and they just want to get magnesium. They're going to be able to get a high quality magnesium through us. It's a nice tasty formula as well. We're using either kind of like a fast melt chewable like delivery format. We know that there is a little bit of capsule fatigue in the marketplace, and so we're kind of shifting, our marketing and where we're at, and how we target people and millennials and even the older population. They want these chewables with some of the better sweeteners, if you will, to make it taste good. We're not using sucralose or Ace K or aspartame. We're using things like xylitol and stevia and a few other natural sweeteners. So stay tuned for those updates. G3, an incredible superfruit juice that features the GAC fruit from Vietnam. AgeLock Youth, based on our innovative AgeLock technology, where we actually look at and study gene expression in multiple tissues, and we see how gene expression changes with the aging process. To be honest with you, based on our data, we bought a company called LifeGen, and we've added to this genetic database that we have. We've been able to analyze the data and see widespread aging changes that happen. And apply some of this incredible science. But basically what happens in these different tissues, so you look at the heart, the brain, the muscle, the liver, fat tissue, you usually see about 3,000 to 5,000 genes that change in their expression or activity patterns as we get older. So when you compare a young liver to an older liver, you see about 3,000 to 5,000 changes in gene expression. And those 3,000 to 5,000 genes or so, there's very little overlap between those in the liver, for example, and the heart or the brain. And so when other companies talk about they found the one anti-aging gene, we kind of laugh at that because it doesn't exist. And that one anti-aging gene, if you will, in the heart may not even change in expression in the brain. So it has no impact on aging in the brain. So in any case, we're doing tissue-wide studies, and Age Lock Youth is kind of the culmination of our project with LifeGen, where we looked at this model of improving the aging process and reducing a lot of the side effects that happen with aging, in the heart and the brain and the joints and the skin, in the eyes, and all these different tissues in the body. And we said, what are the ingredients that are going to mimic healthy gene expression in multiple tissues throughout the body? And we have that data and present it to scientists, and people are just impressed with that kind of results. We have a TR90 system. It's a weight loss and weight management system. HLOC-R squared is a product with incredible ingredients. Some of the history behind that began with Cordyceps sinensis, CS4. So we have a lot of Chinese scientists that actually do a lot of work for us, and they bring a lot of the Chinese medicine, if you will, into the Western world. And one of these Chinese secrets is this Cordyceps mushroom that has incredible vitality and stamina benefits. In fact, athletes would use it, Olympians would use it, and believe that it gave them some kind of advantage even before the studies showed that it can help to improve VO2 max and other parameters of lung support and other parameters of energy and mitochondrial function. In any case, so there's so many different strains of cordyceps, and this goes back to our 6S process of looking at, the CS4, which is the highest quality that mimics the way that it kind of grows in nature, and that's what we put inside of this product to provide this energy boost at the source of aging as it relates to mitochondrial function inside the body, which is another theory of anti-aging that's gaining a lot of steam, to be honest with you. You look at the mitochondria, the function and number decline as we get older, and we've been able to reverse the gene expression changes that impact how our mitochondria function inside the body in terms of supporting its function, supporting energy production in a normal, natural way. So we have many other targeted solution products as well. I mean, I could go through just all of these or just a few of them. Maybe I'll mention the eye formula there. I know that we have some eye docs that are with us. I talk to them a lot about our eye formula. It's based on the AREDS and AREDS 2 studies. So these are the biggest studies. AREDS stands for, okay, my brain is going away here. I've been talking too much, but age-related macular degeneration. Yeah, in any case, so these are the biggest studies related to eye health, and they study different formulas. The first one was kind of a basic formula. The second one, they added different tiers, looking at how fish oil, how lutein and zeaxanthin, how other nutrients might impact the results. And in the end, we actually combined the best of those results all together in the eye formula. So it has a clinically effective dose of lutein and zeaxanthin, so 10 milligrams of lutein, and 2 milligrams of zeaxanthin. It has other supportive nutrients like the vitamin C and vitamin E. I should note our vitamin E is using the natural vitamin E, whereas in the ARED study they use the synthetic. We're big believers in using the best sources of ingredients. Natural vitamin E comes in different isomers, if you will, right? Alpha tocopherol, and those are absorbed and utilized inside the body. Whereas with the synthetic form of vitamin E, it comes in 8 different isomers or 8 different forms, and the body only recognizes or utilizes very effectively in terms of absorption and utilization only 4 of those, just because they come in the right form in the body. And so in this case, natural absorbs at about a 2-to-1 ratio. And so we use the natural form in the eye formula. In any case, I think I've gone way over my time, but our products are incredible. I take many of them, people do, and it changes lives. There's my pitch.
I gotta say, you never disappoint. I've seen you on more than a few occasions, and you always leave me breathless with what's coming up next. And that's one of the things that PHARMANEX has, and with 85 scientists, we're continuously innovating, and it's just incredible. Thank you so much for joining us this evening, and we can certainly provide more information on any of those products. As you said, we don't have time to go into the details. We do have some recorded videos on the different products that Tanner has done, getting into the details and everything. So now I'm notified that Dr. Katie has been able to join us. So once again, thank you, Tanner. And Dr. Katie, I've already introduced you once. Please, can you hear me?
I can hear you. Can you hear me?
Yes, I can. Thank you for joining us. Again, I gave an introduction earlier. I don't want to go through that again. But Dr. Katie is just a phenomenal doctor that's been working with this device for a while, and he's going to tell us a little bit about how he came across the technology and how he dove into it to create our white paper and how he uses it in his practice.
Sure. Well, I had a very persuasive RN friend of mine named Lisa Bell, who came calling one day and said, and she loves to tell this story. She wanted to talk to me about the scanner, and my office manager gave her about a 15-minute appointment, and I was running about 10 minutes late. And I got to the appointment. I said, okay, I've only got 5 minutes. Tell me what you've got, and if I like it, I'll listen to it more. And so she told me. I said, okay, that sounds good. So then I went to her home and had my very own antioxidant scan. At the time, I was taking $300 worth of supplements from a well-known anti-aging clinic, and I scanned 27,000. And I was very miffed. So I began starting on the LifePak Nano, and my score climbed up very nicely, and it stayed up. I got really interested in the scanner. I decided, okay, I'm going to use this. We actually had a scan extravaganza at my wellness institute one day, and the local paper came out and covered it. And we were bringing in people who just wanted to know what their antioxidant level was. So I was intrigued, but I wasn't totally sold yet. I wanted to know about the science. Now, if I'd had Tanner Gibb talking in my ear back then, I would be good, or would have been good. But I wanted to know about the science, and so I dove into the literature, and my first effort was the original white paper, which was in, I believe, 2006. And then I came back and I edited it and put out an updated version in 2017. It's about time I did it again. It's been remarkably useful in my practice, and I apologize for the technical difficulties earlier. I don't know if anybody has talked about COVID-19 and antioxidants and antiviral effect. I gave a webinar on that yesterday evening. Anybody that wants to watch it can go to katiewellness.com/hope, HOPE. And I've got the biophotonic scanner in there, and I talk about the science that shows that it produces a very reproducible measurement. And then I also reviewed the literature. So I'll just share this little factoid with you, and then I'll stop.
Great stuff. Very, very good. Really appreciate it.
Lawrence, I want to get this out. Just a second.
Sorry, he must have been thanking Tanner for being on the call. So I muted him. Go ahead, Dr. Katie.
Okay, thanks. So Saturday, 19,633 citations in the peer-reviewed world medical literature on antioxidant and immune function. And then if you dig in underneath that, there are multiple studies on vitamin C, vitamin E, vitamin D, and even zinc having antioxidant functions. And it's the antioxidant, particularly vitamin C, accumulates in the little cells of the immune system, the phagocytic cells that engulf infected cells. And it also helps generate reactive oxygen species, which kills things. So there's never been a better time to get your scan score up and get your antioxidant level up than now. One other item, I listed toward the end of that all of the supplements that I take. And the first on the list was what I described as a multivitamin, multimineral fish oil system taken twice a day. I didn't say Life Pack Nano, but that's my foundation. And right now I'm taking reishi twice a day. I'm taking extra vitamin C. I'm taking a supplement called K-Force, which is 5,000 IU of vitamin D and 180 of K2. Tanner was talking about K a bit ago. And somebody said, this is a punchline. Somebody said in the chat, or the question and answer, wow, you really take a lot of supplements. And I said, yes, and I don't want to get COVID-19 either. I want my immune system to be in as impeccable a condition as I can get it. And I can think really of no other way better than Life Pack Nano beginning as a starting fundamental foundational ingredient for a supplement regimen and for holistic wellness. So what else would you like to know? I suspect that we're over time. I'd be happy to answer any questions or just say goodbye to everybody. This has been so cool.
No, we're not letting you go that easy. I do have I would like a comment on this. Dr. Richard Cutler from the National Institute of Health has a quote that the amount of antioxidants in your body is directly proportional to how long you will live. That's Dr. Richard Cutler from the NIH. Do you have any agreement with that fact? Are antioxidants that important?
There was, yes, they absolutely are. I believe he was right. And I'm going to tell you what my absolute favorite study is in the entire medical literature about antioxidants and longevity. And it is in a paper by Akbarali, Akbarally. And it is the Epidemiology of Vascular Aging Study. So what Akbarali and his colleagues did, they looked at about 14,000 people. They were older, middle-aged to older adults, men and women, and they measured their carotenoid level. And then when they got their carotenoid level, they sliced and diced it into the top quintile, the next to the top quintile, the middle quintile, the next to the bottom quintile, and the bottom quintile. And then they looked at their data. And they found that if you were in the bottom quintile compared to the top quintile, your risk of what's called all-cause mortality, or basically being dead from anything, was 2.79 times higher than if you were in the top quintile. And that was for all-cause mortality. And then cancer, your rate was about 1.8-fold. So an 80% increased risk of cancer if you were in the bottom quintile. I think that speaks volumes to the need for adequate antioxidants, and in that case, carotenoids. And you can basically make carotenoids and antioxidants equal. So when Akbarali was talking about carotenoids, he was talking about your total antioxidant status. So there's that one. There's the paper by Bruce Ames that Tanner Gibbs mentioned about and the title of the paper is The Micronutrient Theory of Aging. And it's a very good paper. And he, like other authors, I'll tell you the other author in a second, he notes that the amount of nutrients that we have in our diet will generally prevent radical deficiency diseases. In other words, we won't get rickets or scurvy, but they're not optimal for protecting the DNA, repairing the DNA, etc. And just last night, I was quoting Fletcher and Fairfield that were published in JAMA, Journal of the American Medical Association, in 2002. And they looked at supplementation and they said, pending strong evidence to the contrary, it seems prudent for all adults to take a nutritional supplement. And the reason for that is, they said, again, like Ames, our diet is adequate to the point that we don't get rickets or scurvy, but it is not optimal for our health. I would also add it's not optimal for your immune system function and protecting you from COVID-19. So my goodness, everybody should have their antioxidant scale measured and get started on a product that will do them good. One other thing I'll mention, the scanner doesn't care what supplement you take. It does not care. It is agnostic. It has no belief one way or the other. So if you're taking a high quality supplement that is as good as ours, it will do really well on the scanner. If you are a vegetarian that's really enjoying your fruits and veggies and you have an 82,000 scan score, you obviously have enough antioxidants and carotenoids floating around. Unfortunately, vegetarians can sometimes be sick because even though they've got carotenoids, they don't have some of the other trace minerals and elements that they need. So what I like about, I'll circle back to the scanner and LifePak Nano for a second. What I really like about this is it's kind of a closed system, and you have a supplement that will raise the carotenoid score, the antioxidant score. But the interesting thing is the body does not absorb carotenoids and antioxidants by themselves. It absorbs everything. So if you've got a very nice high level on the scanner showing that you're absorbing the carotenoids and the antioxidants from LifePak Nano or LifePak, you're also absorbing zinc, magnesium, B vitamins, all the other stuff that's in LifePak and LifePak Nano, because you can't absorb carotenoids differentially. So for me, when I'm treating a patient and using these supplements, is very reassuring to me to watch their scan score go up and know that not only is their antioxidant level going up, but also their other trace minerals and nutrients.
That's fantastic. Thank you. And I have one follow-up question with that, because this device measures nutrition level, which should be important in every type of physician's practice. You're a psychiatrist. How does that relate to, how does nutrition relate to psychiatry?
Well, I'll tell you. In psychiatry, everything bad in psychiatry is associated with oxidative stress. So I'll prove it to you. Anybody here can go to pubmed.gov and type in autism antioxidant or autism oxidative stress, and you can do depression oxidative stress, bipolar oxidative stress, schizophrenia oxidative stress. Any affliction you want is correlated with oxidative stress and lack of antioxidant function. So instead of just pushing Prozac and trying to fill people up with antidepressants, I like to do it in a holistic, balanced way. The other thing I'll mention is, even outside of my specialty, anything that's bad in medicine typically is associated with oxidative stress. So rheumatoid arthritis, cancer, degenerative joint disease, lupus. You take your affliction, plug it into PubMed.gov, and type in antioxidant or oxidative stress after that, and prepare to be shaken to your core if you don't know about this. So I think it's just an incredibly wonderful baseline, fundamental, stabilizing supplement to be on.
Dr. Katie, I want to personally thank you for all of us for being on this call. Your credentials are impeccable, and your wisdom is greatly valued. Thank you very much for your time. We're going to move on now to Ryan Lucci, who's going to open the floor up for questions. I've worked with Ryan for a little over a year. He's a distributor and a medical device rep that's been in the business for in medical sales for about 7 years. He's a pleasure to work with. And Ryan, I do have one question right off the top, and I don't know who might be able to answer this, but are the carotenoids in curcumin detectable by the scanner? So let's lead off with that question, and then I'm sure there's some more questions you can add into that.
I think Tanner actually jumped off the call.
Oh, did he? Okay. All right. Well, I'll follow up with this physician on that question then. And Ryan, are you there?
Perfect. I am. Thanks, Mike. And thanks everyone for being on the call this evening. That was phenomenal. Thank you very much to all of our speakers. I will say, if anybody has to, I know we're a little over on time, we'll do a few questions. If anybody has to jump off the call, but has more questions or wants more information, please reach out to the person that invited you on. So we have a couple questions in the chat here. Feel free to please type your question there, or you can select the raise your hand little button there, and we can unmute you and you can ask your question that way as well. But to start out, Dr. Katie, I think this is probably a pretty good question for you here by Dr. Perriman, who says, do you have data on the repeatability of the readings and correlation with serum levels?
Yes. Now, do I have the data? No. Has it been published? Absolutely. And I haven't answered that question, and then also an answer to the curcumin question as well. In terms of correlating the carotenoid score, it actually correlated 3 ways, and it's in the paper. Back in the day, the way that carotenoid levels were measured in the skin was you would actually shave a piece of skin off and then dissolve it in alcohol and then do wet bench work on to determine the carotenoid level. The second way you could do it was you could get a blood level of carotenoids. And the third way was that you could use the scanner, and they all correlated. It's in the white paper. If you look for Katie white paper, it's in there. The other thing I'll mention is, and I mentioned this last night on my webinar, in all of the peer-reviewed medical literature, and you look up Raman spectroscopy carotenoid, and if you look that up, you will find basically every paper that says it works, it's reproducible, and so forth. One of my favorite studies is one where volunteers were scanned 1 time per month for 6 months. And at the end of that, it was found that 1 scan would have done it. That 1 scan was associated with the mean of all 6. So in other words, this is not something that swings widely from one side to the other. Very well established. The answer to the question about curcumin is yes, it should show up on a scan score. Curcumin has a yellow, it's got a yellow pigment to it. That's the reason it looks yellow in curry. That's the reason your curry sauce is yellow. And the things that give plants and herbs their color, that's carotenoids. So carotenoid orange. In your apples, it's got a carotenoid. Curcumin has a carotenoid. So carotenoid has alternating, I believe it's diene double bonds, which has a particular Raman resonant frequency. And what I don't know is what the balance of the antioxidants, the carotenoids would be if you take, for example, LifePak Nano, knock down a carrot juice, eat an apple, and take curcumin. I don't know what's going to be measured. The scanner measures kind of the total carotenoid level, but I would think that curcumin would inflect it somewhat.
Excellent. Thank you. Thank you. Any other questions? Dan, are you seeing any other questions in the chat here?
I am not seeing any other questions. So, we're running a half hour over time here. I think it was well worth the wait for those of you that kind of hung with us. Fantastic job by all the physicians who presented tonight. A lot of very, very useful information.
Question?
I speak for all of us when I say we're really appreciative of your time. And I just want to kind of reiterate here that the next steps for those of you who are looking at this for your practice or to getting in this to be a distributor is contact the person that invited you. The next step would be to register with the person that invited you, and then I would encourage everyone to attend our national conference in Provo, Utah. Hold on a second, we might have another question here. Let me just double check.
I have a question that came up in the chat box. Can I reply to that? This is from well, it's a private, so I won't say the name, but somebody said, is last night's webinar available for replay? And I thought I should give a little caveat. It is going to be on katywellness.com/hope. It is not there yet. If you'll keep checking back, I swear to you, it will be there. And there's some good stuff in that webinar.
Great. Thank you for verifying that for us. So there is one question in here. What providers are really interested in this? Cardiologists? To that, I would say cardiologists would definitely have an interest in this because it's very, there's a lot of literature out there on antioxidants and increasing your levels and decreasing your chances for cardiovascular disease. But we're really talking to physicians of all specialties. Dr. Katie's a psychiatrist. Dr. Feltz was on tonight. He was is a optometrist. Dr. Sanderson is a emergency medicine and health and wellness doctor. But we're basically seeing that all doctors of all specialties are interested in this technology. And that's kind of what the beauty of this is from a sales standpoint, is it really increases your ability to call on different specialties and opens up the opportunity for business and expanding the business. So it's a great tool. We're really encouraged with the way things are going. We're growing exponentially month over month. We're seeing tremendous interest from physicians, especially now. For a number of reasons, I believe. One, they've kind of haven't been able to practice with seeing their normal volumes of patients, so they're looking for other ways to generate revenue. I think with the COVID-19 and other things that may be coming in the future, it's everybody's seeing the benefit from patients to physicians in helping themselves become healthier and helping to mitigate these diseases. So it's fantastic from a number of different avenues. I encourage everyone to explore this a little bit more. Ask whoever invited you for additional information if you require that, to kind of set your mind at ease about the company, about the products, and get the information that you need to know that this is a product and a company that isn't going to embarrass you and your reputation. So Lawrence Kazan-Cassini is going to kind of wrap things up here tonight. Lawrence, are you there?
Good evening. I will not take much time. I thank you, everybody, for being on the call. Thanks, Dan, Ryan, Mike, Dr. Katie, Andy, and Dr. Sanderson and of course, Tanner, for the interventions. Thank you so much. I just want to wrap up in the following, and that is that, 70% of non-communicable diseases are preventable. At an oncology conference last year, one of the oncologists said 70% of non-communicable diseases are of choice. And I said, what? She said, yes, you choose to smoke, you choose not to eat well, you choose not to exercise. So 70% of non-communicable diseases, cardiovascular, hypertension, diabetes type 2, lots of cancers, among the others that Dr. Katie mentioned. So every single physician in the United States needs to have some kind of insight into preventive medicine. We cannot continue simply being useful messengers for the pharmaceutical industry and just writing scripts for the pharmacies. So 60% of the US population is overweight, 30% morbidly obese. There we have diabetes, we have things like sleep apnea, we have gastric bypass. Why sleep apnea? Because that's the immune system at night that's impaired. Gastric bypass. knee surgeries. You know, these are all ramifications of what there is. Diabetes, huge. Opioids, obesity, pain, inflammation. So when we start looking at this, why are we focusing on the doctors? Because the doctors are the influencers. They have 3,000 to 5,000 patients a year. But if they know nothing about nutrition, we're in a deep hole. We have to give them the tools to validate what they should know about nutrition. And the scanner is that, and it's backed by the science, the passport to the future, the science, technology, and innovation. Doctor sees 25 to 40 patients a day. That's ridiculous. I listened to a doctor a year ago, and she said, I said, how many patients do you see? She said, not enough. And I said, really, how many? She said, 29. And I said, that's more than enough. She said, no, I can't make out because insurance sucks, reimbursement sucks, electronic records takes up time. So I understood there, it's no longer just about the patient, it's about the survival of the doctor. If we don't help the doctor have some form of financial support, he's going to be on this treadmill, and instead of seeing 25 to 40 patients, he's going to have to try and see 60. That's ridiculous. So at the A4M, we had 24 scanners going. We scanned 2,000 physicians at the A4M in Las Vegas in December. Dan was there. They were lining up to get scanned. That's a brand new horizon. Doesn't happen. Finally, we're getting through to the doctors that this is something that they need. Science-based evidence. And this is what it's all about. So the key to the future is to be able to monetize prevention. And that's where we are now. So I'll just wrap up with that. And I also want to mention that we will have the same type of webinar on Thursday. And Tanner Gibb speaks Spanish, so he'll be on Spanish. We've got a stellar group of doctors on Thursday as well in Spanish, and it's for the Hispanic market. We are in 50 countries. South America comprises a bunch of those, and so the thing is, let's try and support these doctors so that they can validate what they should know with their patients and help them make money and get off the treadmill and stop them burning out by the time they're 50.
Great, Lawrence. Thank you very much for your insight. And, you know, this is a very passionate company. It's a very passionate team of distributors and individuals who are very passionate about bringing this to physicians and bringing it to patients and, you know, really making a difference in medicine, helping physicians practice preventive medicine and allowing it to be profitable for them to do so. So I hope this was beneficial for everybody tonight. I thought it was fantastic and a lot of great insight from physicians and everyone involved. So we're going to wrap it up. Thank you very much, everybody, for taking time out of your schedules to be with us tonight. Thanks, everybody.
Thanks, everyone.
Thank you.
Have a great night.
Thank you.
Thank you.